Hey guys, good evening. Am I visible and audible to everyone here? Just drop a quick yes or a thumbs up if yes, and I am good to go. All right. So, hi guys. Finally we are meeting for our first class of FMGE images. Hi Vendan and Meet and all the others who are joining in. So this is the first class of our series after a long time. Yes, very, very long indeed. After 60 long minutes, we are meeting. So, welcome back to one more special class. I don't know how many of you did see the earlier classes, but this is our officially the first class for FMG students after we did that planning the other day. So, this will be a continuing series that we are starting, all right, where we will look at a lot of radiological images and we'll try and figure our way out through them. Okay, so that is the whole plan. Any of you who are meeting me for the first time and don't know me, my name is Zainab and I have done my MBBS and MD in radiology from AIIMS, and I will try and make radiology easy for you, and I will also try and integrate some other subjects while we are doing radiology so that your job becomes a bit more easier. Okay, so that is the whole aim in this particular first class while others are joining in. We will be starting with neuro, something which is very, very important. So you will at least get one question. Yes, forever single, definitely ortho पढ़ा दूंगी. आप काफी हर क्लास में यही comment you keep copy pasting it. करा दूंगी, पहले रेडियो पक्का कर ले, फिर विल डेफिनेटली स्टार्ट ऑर्थो. ओके, साथ साथ एमएस के रेडियो में आई विल डेफिनेटली मेक श्योर कि आपका ऑर्थो हो जाएगा. ऑलराइट, सो वी विल डू as much as possible. Obs and gynae also. Yes. ठीक है, let's start. All right, so as we had planned, every Saturday Sunday, so starting today is Sunday, so from next Saturday Sunday we'll be having these classes. All right, every day, I mean every Saturday Sunday for 2 hours each. Okay, so that is the whole plan. Patho micro pehle radio start karte. All right, so everybody is requesting for everything other than radiology, so let's start with this and then we'll try and put in extra things as the time permits. Okay, so pehle radio ko cover karenge, pakka karenge, and then we will have other subjects. Okay, so that is the whole plan, because my main responsibility for you guys is to clear your radio first, and believe me, अगर आपका रेडियो स्ट्रांग होगा आपके बहुत सारे सब्जेक्ट साथ साथ क्लियर हो जाएंगे. सो इफ यू कैन आस्क basically your previous seniors who have given the exam last time, so it really helps if this subject is strong, right? So that is what we will try and do. Shivashankar, why multiple myeloma has a cold spot is your doubt. So remember, any time, so just everybody excuse me for like 1 minute. So on a bone scan, remember, we will have an uptake only when there is any osteoblastic activity. Correct. That is what our bone scan is testing, Shivashankar. So because in multiple myeloma, you don't really have any new bone forming. What is happening in multiple myeloma? In multiple myeloma, you have these cells, these plasmacytes, which are proliferating in the bone marrow and they are growing. Correct. So basically, there is just no bone ka role. Bone is just getting lysed because of the infiltration of these plasma cells. So that is why these will appear as lytic lesions. Does it make sense? So that is why there is no hotspot. That is why there is only cold spot in multiple myeloma, and that also explains why the ALP levels are normal, because no new bone is getting formed. Okay? Okay, good. Thank you, Jamal and all the others. So now with this, shall we begin? So today's agenda, I will quickly tell you. Before that, I'll tell you something about Unacademy. So this is the plus subscription where you can take all the batches which are available. All right, a lot of you have signed up for Unacademy, I had seen. So you can join your Focus FMG course where you will have a structured batch course for all the subjects. So you can do that if you're just starting out. And this is the code that you can use for subscription, which is ZVORA. You'll also need this for unlocking the special class plan, so you can also use the same code, which is my name, ZVORA. Okay? Keep interacting, guys, and because we are starting out today, so this I will this will be like the first class in a long series of classes. All right, so be interactive. I will keep asking you questions and you keep giving me answers, and we'll have MCQs in between with live polls. All right, so that is the whole plan of action with this. Today's agenda, I will quickly tell you. So we are starting out with neuro. Okay, so we will see a few neuro images. We'll start from the very basics. So how many of you here feel that you don't know any radiology? Just type in a yes so that I know that I have to start from where. Is there anybody who feels that I don't know anything? Like this is the first time I'm studying radiology. Yes, fine. Even one person says so. A lot of people are saying yes. Okay. So we will be starting from the very basics, like what is right, what is left, what is hypodense, what is hyperdense. Okay. So that is where we'll be starting from, and then we'll keep building our way up. And finally, before your exam in June, I want that you at least reach 99, if not 100. Okay. So that is the whole plan. So let's start with zero today, and take baby steps and reach somewhere hopefully. So this is a 1 hour ka class today. It was planned as a 2 hours. So let's because I have had too many classes today, I have made this a 1 hour class. All right, and next time onwards from Saturday Sunday, if you feel that 1 hour is fine, we'll keep it 1 hour, otherwise we make it 2 hours. All right, so we'll be flexible with that. ठीक है, so शुरू करते हैं. Enough chatting done, and शुरू करते हैं अब. Fine, so these are the investigations. ठीक है, we'll see 1 hour 2 hour, we'll decide. Okay, no issues. So here I am showing you the basic radiological investigations which we use, right? So 4 basic radiological investigations. Try and identify them for me if possible. What is this that I'm showing you here? So this is the first step where we identify investigations. Very important. Correct. So this is X-ray. One thing about X-ray, is it a 2D investigation? Is it a 3D investigation? Do I take slices, or it is just one image that I will get? It's a 2D investigation, correct? It just gives me this one solitary isolated image which will basically combine everything on the way. So there'll be a superimposition of everything. If I take a chest X-ray, my heart, my ribs, my scapulae, everything will be superimposed. So one thing about X-ray, it's a 2D investigation. Second thing, does it have radiation? Does it have radiation? Yes, it does. Okay, so X-ray will have radiation. It's a 2D investigation. ठीक है, fair enough. Then X-ray का ही, if I take a 3D brother who can give me slices, who can give me coronal image, who can give me sagittal image, can I just say that this is X-ray only, but it's a 3D way? I am taking X-ray 360 degree में, such that I can get any plane that I want. So what is that? As all of you are correctly identifying, this is a CT image. So now when I ask you the question that does it have radiation? It is X-ray only in 3D way. So it will also have radiation. Correct. This also has radiation. One more logical question for you. Will it have more radiation than X-ray? Lesser radiation than X-ray? More. It's a 360 degree X-ray. Correct. So this will have far more radiation than X-ray. So this is something we have established. We have established it's a 3D investigation. It can give me different planes. So now if I have another 3D image alongside X-ray, alongside CT, what is this? Another 3D image that gives me slices? Correct. This is MRI. This is MRI. Now the golden question, does it have radiation? Does MRI have radiation? Why is MRI so popular? For somebody who doesn't know anything about radiology, I'm sure you know that MRI is very good, right? MRI is very good because it doesn't have any radiation, and it is something which is very expensive also. Yes. So the one of the causes behind its expense is its mechanism, that it is based on a magnetic field, right? It is based on creating a large magnet and then having our body produce signals. So in this process, we don't use any X-ray. We are using the protons in our body to generate signal. So very basic. So remember, no radiation. No radiation with MRI. Is it 3D? Yes, it is 3D. Okay, then coming to one investigation here. What is this? What is this here? This is ultrasound. Perfect. This is ultrasound. One question for you. Is ultrasound having radiation or no radiation with ultrasound? Again, no radiation. Ultrasound uses what? It doesn't use X-ray, it doesn't use magnetic field, but it uses what? It uses sound waves. So can I hear these sound waves? Are they sound waves which fall in our auditory range? Can I hear those sound waves going through my body? No, not really. So they are in what range? They are in the ranges of megahertz. All right, so I use somewhere around 2 to 20 megahertz of sound waves, which is far beyond our auditory field, right? We can't hear about 20,000. So 2 to 20 megahertz, that is why ultrasound will not make any noise. So this is also no radiation. And one more thing about this, can I generate 3D images here? Yes, here I just have to move my probe. Okay, in the direction that I move my probe, I will get an image. So this is also a 3D image. Perfect. So out of these 4 investigations that we need to learn about, what did we establish? 2 have radiation. X-ray and uska 360-degree brother, which is CT. MRI and ultrasound, very good. They do not have radiation. Is that fine? So now coming to the main thing about today's agenda, which is neuro, right? So whenever we talk about the brain, remember the 2 main investigations we will be talking about will be CT here and MR. These are the 2 main investigations which have a role as far as the brain is concerned. So far, everybody is fine. Everybody is understanding what we are doing. The very, very basic stuff is clear in everybody's minds. ठीक है, we keep adding on to this knowledge as we go along, right? So how do I go about distinguishing CT and MR is what we learn next. But before that, something very basic that I want clear in everyone's mind. What is right? What is left? So remember, always imagine, whenever I'm showing you this image, always imagine that this is a person जो आपके सामने खड़ा है. So that will make this what? That will make this right. That will make this left. Easy. What about MR? Will it change? Nope, nothing will change. This will be right, this will be left. What about X-ray? Even though it is a 2D investigation, will right, left change? No, still not change. So here, this is right, this is left. So is our right, left clear for everything? Ultrasound, I can't write the same because ultrasound में it will depend कि probe कैसे रखा है. So remember, ultrasound, nobody will ask you right, left. But X-ray, CT, MR. Are we all clear how to recognize right and left? It is ulta. It is just ulta from me. It is like a person who's standing opposite to me. So far, so good. Everybody, nobody is mistaking right, left, because from now on, I will ask you questions about right, left, and nobody is getting them wrong. Okay, clear? Yes? Everybody with me so far? Yeah? Cool. So this is right and left. Now we go about a few terminologies. I want to sound very fancy like a radiologist and use these fancy terms. Ultimately, what is radiology? Black, white, and everything that comes in between. Correct. So now how do I express it in terms? I can't use the word like layman ki black hai, white hai. I can't use that. I need to sound fancy like a doctor. So that is why we have made these terms. अल्टीमेटली तो यही बोल रहे हैं क्या ब्लैक है क्या व्हाइट है बट इन कॉम्प्लिकेटेड टर्म्स ओके सो लेट्स मेक सेंस आउट ऑफ दिस सो व्हेनेवर आई हैव एन एक्सरे and I see something is black, what is the term I will use? Something which is black, lucent. I will use the term that I am seeing a lucency, something is very, very lucent. When I see something is very white on an x-ray, what is the term I will use? Anything that you see white, not transparent, opaque, right? So anything which is white on an x-ray, I will say that it is radio opaque, or I will say if it is black, radio lucent. So opaque or lucent. ठीक है. Now everything is very easy. So x-ray was 2D, मैंने अलग नाम दिया था. CT, MR, ultrasound all will be hyper, but the suffix will change. What do I mean? When I say something is black, I will write hypo everywhere. I will write hypo. If something is white, what will I write? I will write it as hyper. But the kind of suffix I use will change depending on the investigation. So if I am saying something is black on a CT, what suffix should I use? What suffix should I use? I should use the suffix dense. So if I see a black lesion on a CT, instead of saying अरे ये काला है CT पे, I will write it as hypodense. Similarly, if it is white on CT, I will write hyperdense. ठीक है? Same. MRI में क्या suffix लगा देंगे? Hyper remain the same. I will use the suffix intense. So यहाँ पे क्या कर देंगे? Hypointense. यहाँ पे कर देंगे hyperintense. Easy peasy. Then ultrasound में क्या करेंगे? We will just add it echogenic. All right, we will use the term echogenic. So what will I say basically? Instead of writing echogenic, I can also write echoic. So I can write hypoechoic, hyperechoic. ठीक है? Easy. So let me ask you a question. If I'm doing an ultrasound and I find a very, very black color का lesion, what will I use? What term will I call this? Hypoechoic, hyperechoic, hypodense, hyperdense, lucent, opaque. So काला है मतलब hypo है. Ultrasound है मतलब sound waves, echoes. So I will use the term hypoechoic. Everybody agrees? Okay. So this is when something is black. What if I want to make it slightly more complicated for you? If there is a pitch black lesion, मतलब हाइपो तो काला का शेड हो सकता है. व्हाट इफ आई एम टेलिंग यू जेट ब्लैक, बिल्कुल ही ब्लैक है. सो फॉर अल्ट्रासाउंड वी हैव एडेड वन मोर टर्म. व्हेन इट इज जेट ब्लैक, नो पिच डार्क, देन आई कैन कॉल इट इको ही नहीं है, anechoic. Okay, so here I will just remember that there is something called anechoic. But remember, there is no an intense, there is no and dense. Okay, it is just for ultrasound that I have kept this anechoic. Here only I will like to tell you, although we are going to discuss neuro, but here only I want to tell you, ये नाम ना हमने एक ही चीज के लिए रिजर्व किया है, which is special, ultrasound special. What is that? What is anechoic? What is pitch black on ultrasound or pitch dark on ultrasound? It is pani. It is fluid. It is not air, it is fluid, remember. So anything to do with fluid, I will remember from today onwards that my answer is going to be ultrasound. If they are asking me who will detect minimal pleural effusion, who will detect minimal ascites, both are fluid. Who will detect a cyst? What is a cyst? It is a pani ka gola. So anything fluid they ask me, I know that fluid ka ultrasound pe ek special color hai, which I have given a special name, which is anechoic, pitch dark. So that is why all of these answers are going to be what? All of these answers related to fluid and its diagnosis are going to be ultrasound. So far so good. Everybody understood the names. So from now, when I ask you questions, are we going to sound fancy and use all of these fancy terms? Yes. ठीक है, wonderful. So terminologies are done, right left is done. So our basics are now sorted. Now we add up to this. Now we go on with the first thing, which is neuro. Now we are going into the brain. Okay, now we are not coming out of brain. Now we are not going into ultrasound and everything. Now our attention is going to be CT, MR. So which is CT, which is MR? That is what is my first question. So what do I look at to decide? So remember, what I look at is the bone. I look at the bone. What is the outermost part of our skull? First we have some scalp and then I have the bone. Correct. So here when I see this very, very white color ka structure here, what is this very, very white color ka structure? This is our bone. So remember one thing here. What is how is the bone on a CT? The seat on CT, the bone will be white. Okay, that is our first learning point, that when I see a bone which is white, it has to be CT. That is going to be my starting point, whether I give you CT of chest, abdomen, skull. Yes, very good, KD. So KD is saying it is hyperdense. Perfect. So our hyperdensity on the CT is going to be bone, is my first thing. Can I also extrapolate and say that because bone mein calcium hota hai, any other calcification will also be white? Can I make that generalization? Yes. So what did we learn? That anything calcium, whether it's bone or it's any other calcification, I will see it as a white spot on CT. ये सब खुश है इस बात से. Now let's see how the bone appears on MR. So if I ask you, what is this? What is this white color ka rim that I'm showing you outside? Is this white color ka rim the bone? No, not really. So this is not the bone. This is actually the scalp fat that I have. Okay. But when I go beneath that white layer, when I go into this black thing, what is this black thing? If I had to draw it here also, what is this black thing that I'm drawing out here? That is the bone, right? This is the bone that I am having here. Okay, so one difference, how do I start off saying whether it's a CT or it's an MR? I look at the bone. Okay, if the bone is white or hyperdense, I say that it is CT. If the bone is black or hypointense, it is MRI. Everybody agrees with this? So we will not confuse by seeing कि ये fat है, ये ही bone है, ये white है, ये CT है. No, no, no. Look a bit deeper and see. Then you will find the bone and that will be black. Okay, agreed? So how to identify CTMR? So every time I show you one image, my question to you will be identify the investigation. Each and every time from today onwards, I ask you, I want a correct answer, whether it's CT or MR, we look at the bone, we decide. ठीक है? Happy? All right. So now going forward, now we have established कि CT है या MR है. Now MRI is not easy. MRI has various sequences that we need to know. So shall we complicate this further? Shall we go inside MRI and understand its sequences and then look at a few pathologies, right? Okay, so on MRI, two basic sequences that we have are the T1 weighted sequence and the T2 weighted sequence. Okay, so now how to go about that? how to go about that? Before I go into that, first of all, can we establish something on both of these images which look the same? What was the outer part which is white? What was the outer part which is hyper intense? That is fat. Do you all agree कि scalp का fat है? So what do I notice? That although they are two different sequences, fat is bright on both. Do we all agree with that statement? That fat is appearing white on both. Can I say that चाहे वो T1 हो या वो T2 हो, fat तो दोनों में white रहेगा. ठीक है, I agree. Then we go to look at the bone, जिससे हम decide कर रहे थे कि ये MR है. So when I look at the bone here, how is it? It is black. Am I sure that this is MR? Am I sure? Yes, क्योंकि bone black है. What about this image? In this image also bone is black. This image also bone is black. Can I be sure that this is also MR? Yes. So both of these are MR images because both of them have bone which is black. And one more thing I noticed, both of them will have fat which is white. Now, where does the difference start? The difference starts in the very, very center, if you see. What are these? Anybody from a preliminary knowledge can tell me, what are these white things that I'm seeing? What is this normal anatomical structure that I have outlined? Ventricles. These are the lateral ventricles that you have here. What are ventricles made up of? What do the ventricles have? They have CSF. Can I say CSF is pani only? CSF is fluid, end of the day, whether it's CSF or whatever, it's end of the day pani. So if I were to ask you on an unrelated note, if I had to do one ultrasound for CSF, which is pani, what is the color I would see? What is that special name जो मैंने fluid के लिए ही रखा था on ultrasound? कैसा echoic? Anechoic? Correct. So just to remind you basically that fluid is anechoic. Okay, coming back here, coming back to the brain. So here I have fluid which is appearing white on one sequence, or water which is appearing white on one sequence, and one sequence where I have water appearing dark. So now how to decide? So how to decide will be using the mnemonic World War II, which means what? When the water is white. When the water is white, what is the sequence? It is sequence T2. Making sense? So I will always look at the water. I will try and find water, and if that is white, it is a T2 weighted image. Is this making sense to everybody here? So now when I look at the ventricles, also on all of these sulcal spaces, remember our brain has the sulcal spaces. These are the gyri, these are the sulci, right? So in the sulcal spaces also, can you see this white rim? That is also the CSF only. That is also the CSF floating in the subarachnoid space. Correct. So anywhere I have water, anywhere I have CSF, that will be white. That is end of story for me. It is T2. Okay. Now let's look at the other sequence. So then what must this be when the fluid is dark? T2 हो गया, तो क्या बच गया? T1. Do we all agree that this is a T1 weighted image because water is dark? But I want to be doubly sure. I want to be doubly sure that this is T1, this is T2. So for that, what do I look at? I will look at gray matter. I will look at white matter. When we cut our brain, the gray matter is outside, white matter is inside. All of us agree? So this thing outside that you are seeing, do you all agree that this is the gray matter? This is the gray matter, and this thing in the center that I'm seeing, this is white matter. अब अपने color के knowledge से मुझे बताओ, in this T1 weighted, ग्रे मैटर का कलर क्या है, व्हाइट मैटर का कलर क्या है? इज इट मैचिंग इट्स नेम? इज द व्हाइट मैटर अपीयरिंग व्हाइटर एंड ग्रे मैटर अपीयरिंग ग्रेयर? इज इट मैचिंग इट्स नेम? एवरीबडी अग्रीज कि इसमें व्हाइट मैटर ज्यादा व्हाइट लग रहा है. सही है, ठीक है. सो ग्रे मैटर इज ग्रे, white matter is white. It is matching what it was supposed to match. So how did I decide? T1. To make sure that one sequence is T1 weighted MRI, I have checked two things. One, CSF should be what? Or any fluid should be what? It should be black. It shouldn't be white. If it is white, then it becomes T2. End of story. World War II, water is white, matlab T2 ho gaya. But again, I want to be doubly sure it is T1. So I will check gray matter, white matter. If it is gray matter is gray and white matter is white, if it is matching the name, that is definitely T1. Let's see for T2 if it is ulta. Let's check, confirm करना चाहिए कि वो उल्टा है T2 के साथ. Let's see. So here when I see the inside का white matter and I see this outside का gray matter, tell me which is looking brighter, which is looking whiter. Is it the white matter that appears whiter or it's the gray matter which appears whiter? यहाँ पे देखो, ये है gray matter, ये है white matter. Outside का ज्यादा white लग रहा है ना? So उल्टा पड़ गया ये तो. So gray matter white matter. Here I have ulta, where white matter appears darker and this appears brighter. Yes, everybody, is this convinced through the board? Everybody has understood how to recognize? So my first question to you, if I see an image, and I see that the bone is white, what will be the image? What will be the image? This is my starting point. Yes, it is a CT scan. And I know that on CT, any calcification will be white. Any calcification will be white is what my learning point was. ठीक है? अब मैंने देखा bone is black. So now I have to figure out which sequence this is or which investigation this is. This is MRI. In this, I have to go deeper and find out the sequence. So if I tell you that water is white in the CSF, what will be the sequence? T2. Then I tell you water is black and gray matter is gray and white matter is white. What is this sequence? This is T1. So ये अब अभी तक सबको समझ में आ गया? Because I have more complications to add. This is not end of story. There is further more complication. सह पाएंगे और complication सब लोग? करूँ complicate और? Okay. So let's see this image now. Let's see one more image. So उससे पहले, before I show you what this is, please tell me, what is this sequence? What is this sequence? The moment I see water is white, it is end of story. It is end of story, right? World War II. T2 weighted MRI. Perfect. Then if I ask you this, water is black, right? But water is black here also, but they look quite different. These two sequences look quite different. So now I have one more thing. So what do I need to make sure when water is black? That white matter is indeed white and gray matter is indeed gray. So ये अपने नाम पे true है. So can I be sure that this is T1 weighted MRI? Everybody, can I be sure? Okay. So now let's figure out who this is, who this guy is. This guy has CSF which is black. है ना? तो मुझे लग रहा है कि ये तो T1 होना चाहिए. But then to confirm, I started to look at the gray matter, white matter junction. So what is whiter? Gray matter is whiter or white matter is whiter here? I am finding that gray matter is whiter. Do you agree? ये तो उल्टा पड़ गया. This is not what I had expected from T1. T1 में तो नाम के साथ white matter white होना चाहिए था, है ना? तो then what is this? So then what is this? If I had to tell you that this is actually a T2 weighted sequence only, but what I have done is I have suppressed the CSF. मैंने जो भी पानी था उसको kill कर दिया. I have killed the CSF. I have made it black. Then can you agree with my statement that yes, now it fits. It is just like this, but with CSF which is black. So then what is the sequence that I call when I do a T2 weighted minus CSF, killing the CSF? This sequence is called flare. This is called flare. Technetium 99 check is something completely different. Technetium 99 हम पढ़ेंगे जब हम nuclear medicine पढ़ेंगे. This is MRI sequences. Alright, we are into MRI. Technetium 99 बिल्कुल ही दिमाग से निकाल दो. That will be a nuclear medicine sequence. Alright, not even radiology sequence. डिफ्यूजन पे भी आएंगे, वन स्टेप एट अ टाइम. ओके, सो पहले जो हो रहा है उसको अच्छे से समझो, सब कुछ आएगा. डोंट वरी अबाउट इट. ओके, सो दीज आर योर 3 sequences. T1 weighted MR, T2 weighted MR, flare. So what is flare? Flare is a T2 weighted sequence in which I kill any CSF which is there. Now, nobody asked me, why are you killing the CSF? अच्छा भला था तो सही T2 में. Why do you want to kill it? Any idea? Why do I want to kill? I want to retain a T2 weighted sequence, but I want to kill the CSF. For that, I will ask you a question. If I want to test any pathology, if I want to see any pathology, do you all agree that all pathologies will elicit some edema? Yeah, whether it's infarct, whether it's a brain tumor, whether it's an infection, everything in our body which is new, our body reacts against it and produces edema. Everybody agrees with that? So if I have to test edema, what is edema end of the day? If I ask you nature of edema, this is also pani only, this is also water only. Yeah, it is fluid. So then it will be white on which sequence? T1 or T2? अगर इन दोनों में से ही पूछूं, T1 में white होगा, T2 में white होगा. T2 में white होगा. Do we all agree that if I want to pick up pathologies, if I want to pick up edema, T2 is my sequence of choice. So I thought to myself कि अगर मेरा काम खाली edema pick करना है, अगर pathology pick करना है, let me just kill the normal CSF so that I'm not distracted, right? So that it's very easy for me. If I see anything white, I know that it is pathology, right? So basically, just to make our job easier, in order to identify pathologies, we have suppressed anything which was physiologically white. Is this making sense? So just to pick up pathologies better, remember, just to pick up pathologies better, we have done this flare sequence where we stop our distraction. अपने आप को क्यों distract करना? So we will kill the CSF so that any pathology which is there, which is white, will stand out. Okay, making sense so far? So what have we learned so far? If I go back and I ask you, what is this investigation? I will start seeing the bone. Bone is white, it is CT. Then I look at this investigation. I find that outer fat is white, inside bone is black. This is MRI. Which sequence of MRI? Now, if I have to ask you on this image, will you be able to tell me? Good. Here, CSF is white. Everybody is feeling confident, each and every one person. So here I am seeing water is white. This is no questions asked. World War II, T2 weighted MR. Then when I give you a image where water is black, then I will analyze. If the white matter is indeed white, it is T1. But if it is ulta, where the gray matter is actually whiter, that becomes my flare sequence. ठीक है? अभी तक सब कुछ clear? How to recognize sequences? So much we have done. Now we will make it easy. All right, now we learn about anatomy. So this is all we had to know as far as MRI sequences go. Now we need to learn about the anatomy, because you get at least, like if not more, one question sure shot. मतलब अभी जो next 30 minutes में पढ़ेंगे उसमें से एक guaranteed आपका point आपको आज से मिल रहा है. If you remember, that is till June. So you always get one question from Neuro Radio Image. They will give you. So those of you who were stuck at 149, this is your 1 mark today, all right, that you are getting extra. So this is one question on radiological anatomy that you always get from the brain. Okay, so now we will color code this, we will revise this tomorrow, and we will make sure that 1 mark is in our pocket today only, irrespective of other subjects. Okay, so ready to take that 1 mark in the pocket? Before that, tell me, what is this sequence? What is this investigation? What is the sequence? MRI T2, yes, है ना? ठीक है. So this is our water is white and we have the bone which is black. So this, we are all agreeing on the same page that this is a T2 weighted MRI. Yes, all of us agree with this statement. Cool. So now let's understand the cross-sectional anatomy. So first of all, if I ask you, what is this topmost red arrow marking? What are these white color ke ventricles? Lateral ventricle. Can you give me a much more precise answer? Which horn of lateral ventricle? So this is anterior, this is posterior. This side, this is right cortex or left cortex? If I have to ask you this is right side or left side first of all? Right, good. What is this side of the brain? What is this side of the brain? Left side of the brain. ठीक है, इसमें हमें कोई doubt नहीं है. Okay, so now you were correct when you said lateral ventricle. If I ask you which horn? Frontal horn, occipital horn, temporal horn. Which horn of frontal of lateral ventricle this is? So आगे की तरफ है, right? So this is the anterior horn. So this will be the frontal horn of lateral ventricle, right? So these are your lateral ventricles के horn. So now here छोटा वाला पीछे वाला red arrow. What horn of lateral ventricle? Again, I know it is lateral ventricle, but which horn? Occipital horn. Right, posterior means occipital. So this is our occipital horn or posterior horn of lateral ventricle. Fair enough? Then, when I ask you what is this blue arrow? What is this blue arrow? If this is the lateral ventricle and it has to go down, it will go down through which ventricle and then open into the fourth ventricle? This is the third ventricle. Alright, so whenever you see a slit-like ventricle in the midline, this will be what? This blue arrow will be your third ventricle, remember. Okay, so this is your blue arrow showing third ventricle. Now 1 minute. What is that structure which connects the lateral ventricle to the third ventricle? What is that foramen called in between the two? What is that foramen in between which connects the frontal or the lateral ventricle with the third ventricle? Aqueduct of Silvias? वो तो नीचे आएगा, वो तो थर्ड और फोर्थ को कनेक्ट करेगा. Foramen of Monro, right? So remember, where will I see foramen of Monro? If this is the lateral ventricle and this is the third ventricle, can I say this tiny little guy here, this tiny little foramen here is foramen of Monro? Will you all agree with that statement? Lateral ventricle, third ventricle, in between foramen of Monro. So can I write here chotu sa foramen of Monro? Is that fine? Everybody agrees? All right. One more addition to this now. What is the structure which pairs the third ventricle on both sides? If I have to ask you what forms the lateral margin of the third ventricle, what are these two nuclei on both sides of the third ventricle marked by the green arrow? Correct. These are your thalami. This is your thalamus. So this side, which thalamus has been marked by the green arrow? Right thalamus, left thalamus? Left thalamus, ठीक है? And this is the right thalamus. All right, so far so good. Now we have a few more basal ganglia that we need to know. What is this basal ganglia which is in contact with the lateral ventricle frontal horn? What is this that I am marking out with the white arrow? Correct. This is the caudate nucleus, head of caudate to be more precise. So this is caudate nucleus. Then you have something which is quite looking like a lens, which is quite looking like a lens. So what is it that is marked by the yellow arrow? Not the internal capsule, still in the basal ganglia. Lentiform nucleus. Lentiform nucleus. Lentiform nucleus is made up of two things. What are the two things? Outer putamen, and inner, what do I have? Inner I have globus pallidus. ठीक है, everybody agrees. So this is your caudate, this lentiform nucleus made up of putamen and globus pallidus, and in the midline, just lateral to the third ventricle, I have the thalamus. Is this clear? One question sure shot from this. Okay, so these are your basal ganglia. All right, everybody understanding? ठीक है, फटाफट से अब फिर से करते हैं. Now you guys tell me the answer. So first topmost red arrow showing me what? Everybody has to answer now. Which horn of lateral ventricle? Yes, frontal horn of lateral ventricle. ठीक है. What about this छोटू पीछे का arrow? पीछे का lateral ventricle कौन सा horn रहेगा? Yes, occipital horn of lateral ventricle. ठीक है, wonderful. What is the white arrow showing me? What is the white arrow showing me? Near the lateral ventricle? Caudate nucleus. Perfect. What is the yellow arrow showing me? Yellow, shaped like a lens. Lentiform nucleus. Perfect. Made up of what two things? Outer putamen, inner globus pallidus. One question for you here. Which is the most common site of bleed in elderly because of hypertension? One-liner question for you. Most common site of hypertensive bleed. You must have seen in a lot of known people or patients that they have this sudden hypertensive bleed inside the brain. And remember, the most common site, or for your entrance only, most common site for hypertensive bleed is this putamen here. Okay, fair enough? Right. Green wala reh gaya around the third ventricle. What is the basal ganglia nucleus that is around the third ventricle? This will be thalamus. This will be thalamus. And what is this marked by the blue arrow in the midline? That is our third ventricle. And then when I ask you what connects the lateral ventricle to the third ventricle, what will we say now? Will we say aqueduct of Silvias? No. We will say foramen of Monro. ठीक है? Is this section clear to each and every one of you? Now, one more question from anatomy only. So this is caudate, this is lentiform. Now, if I notice very, very carefully, I am seeing that there is one white matter bundle which is going like this between the three things that I have just studied. So if I had to draw out the caudate, the lentiform, the thalamus, there is one capsule which is growing like this, जिसका ये anterior limb रहेगा, ये posterior limb रहेगा, and then I have genu. So what is this white matter bundle going like this? Yes, it will be internal capsule. Is this clear, everybody? So if I have to draw here, this will be my internal capsule. Is this clear? Anatomy making some more sense here? Now, one of you had asked, what is the investigation of choice for hypertensive bleed? Very, very important question, but that requires some more explanation. So, before I go into that, tell me on CT, on a CT scan, what is the thing we already know is white, which will be bright or in a fancy way hyperdense? What are the things on CT that I already know, which doesn't require any prior knowledge? What I have told you today, कि वो white रहेगा, that is how my process was starting. That is how I was recognizing that it's a CT bone. Or on, if I have to say at a molecular level, what is white, bone या फिर calcium, है ना? तो ये हमें already पता है that these two things will appear very, very white. Further adding on to this knowledge, we also have acute hemorrhage. Means that hemorrhage which has happened in less than 24 hours or less than 7 days. Okay, fresh blood, abhi abhi bleeding हुआ है, acute hemorrhage will also be white on CT. ठीक है, can we add that to our knowledge that bone and calcium was white? Acute hemorrhage is also white. Okay, so 3 things. One more thing I want to tell you, I am extrinsically adding something. मैं कॉन्ट्रास्ट डाल दी हूँ ब्लड वेसल में, जिससे कि ब्लड वेसल्स भी अलग से दिख जाए. सो कैन आई से दैट व्हेन आई इंजेक्ट iodinated contrast, that is also white? Yes. So for CT, remember I use iodinated contrast with iodine. So that is also white on a CT scan. Is this making sense? So these are all the things which will be white. So now whoever had asked that question, when I ask you what is the investigation of choice to look for acute hemorrhage, what will you tell me? You will tell me CT, क्योंकि CT में ये white दिख रहा है, I already know. Okay, one extra question, will you give contrast? You will not give contrast. Non-contrast CT, contrast enhanced CT. So now, if I do give contrast, उससे क्या हो जाएगा? उससे ये contrast भी white लगेगा, hemorrhage भी white लगेगा. What will happen? We will only get confused. खुद को confuse करना है, नहीं करना? नहीं करना, right? Why unnecessary confuse? This is already white, this is anyway standing out, so no need of contrast. Correct. So remember, investigation of choice for acute hemorrhage, non-contrast CT. Similar concept, if I ask you, investigation of choice to look for calcification, to look for intracranial calcification. I want to see a calcific lesion. Tell me, what will be the answer? Is that also white? Yes. Do I need to give contrast? No, anyways वो white है. So can I still say that this will be the answer? Yes. All of these concepts are going to be very, very important. Okay, this will make your life very simple towards the end. So please pay attention. Okay, so this is bone, this is calcification, this is acute hemorrhage. All of these things are white. So when to give contrast? All right. So in general, remember, anytime I want to see a tumor or I want to see an infection, I will give contrast. If it is intrinsically white, if it is anyways going to be white, no need to give contrast. So is this clear? So now when I ask you investigation of choice to look for hypertensive bleeding, will you be able to tell me the answer? Hypertensive acute bleed? Yes, NCCT. And if I ask you one follow-up question, what will be the most common site where I would expect to find this white bleeding? That answer I already know. What was that? Putamen, not internal capsule, putamen. Okay, so this is so many of our questions getting answered, right? So this is your hypertensive bleed. So वापस, shall we go back to anatomy now, having gained one more concept here? So now let's go back to anatomy. But this section is clear to each one of us. If this question comes in exam, none of us are getting it wrong. Yeah? All right. Going ahead, one level below it, or before that, same level on a different sequence. So here, if I ask you which sequence this is, first of all, bone is black. So CT or MR? CT or MR? It is MRI. So now my question is T1, T2 or flare? 3 options I have. So I check that water is black, so it can't be T2. It can be T1 or it can be flare. So then how to distinguish gray matter, white matter? What is looking whiter? White matter is whiter. So when it sticks to its name, what is the sequence? It is T1 weighted image, right? Understanding, guys? So this is your T1 weighted MR. Very nice. Everybody has given me a correct answer. I'm very, very happy and relieved. Okay, so now again, What is this anterior part of the basal ganglia, which is near the frontal horn? What should I name this? Correct, perfect, caudate nucleus. What is this nucleus here, shaped like a lens, reminding me of a lens? Lenticular nucleus, made up of outer putamen, inner globus pallidus. So this is your lenticular nucleus or lentiform nucleus. What is this that is shaped here just near the third ventricle, bordering the third ventricle? What is this? This is the thalamus. This is the thalamus. ठीक है? Understood? So far so good. Shall I complicate things a bit here only? So now that this is white matter, now that this is T1, I can see that the white matter is so white. So now when I ask you what is this white matter bundle which is going here, this is the internal capsule, right? Everybody can make it out that this here, this sequence here, it's the internal capsule. Okay, let's further add on to this. Let's further add on to this. If this was the lentiform nucleus, can you also notice one more white matter bundle going here? One more white matter bundle going here. So what is that bundle which is going outside the lentiform nucleus? If this is the lentiform nucleus, what goes outside the lentiform nucleus? Yes, very good. So if this is L, this white matter bundle, what should I label it as? External capsule. Yes, this is external capsule. Cool. Then if I notice further more carefully, I am seeing that there is some gray matter here. There is some gray matter in the outermost part. What is this part of the gray matter? What is this cortex called? Anybody? So इसके लिए थोड़ा सा explanation लगेगा, right? इसके लिए थोड़ा सा explanation लगेगा. So let's see. Before I ask you about the cortex, tell me what is this cistern called? This is one cistern here, which is like a bat wing. What is this cistern? Yes, this is the Sylvian cistern. This is the Sylvian cistern. One important content of this cistern, you can tell me. One major artery जिसके बिना हम जी नहीं सकते. What is that artery which runs here? Yes, you have your MCA. So remember, middle cerebral artery runs here in the Sylvian cistern. Have we learned this now? Now, the cortex, the gray matter which borders the Sylvian cistern, that is called as the insular cortex. Remember, this is your insular cortex. ठीक है? Adding on to our knowledge. So, basal ganglia done, internal capsule done, external capsule done. Then I have the Sylvian cistern and I have the insular cortex most laterally. One content of Sylvian cistern, MCA. ठीक है? So, basal ganglia level is sorted for everybody. Shall we go down to what level now? Now we go to the नीचे का level. नीचे का level is what? नीचे का level is the level of midbrain. है ना? नीचे का level is midbrain. So everybody can recognize this panda shaped. So the moment you see as a panda जैसा midbrain, this is our midbrain का level. So now let's further identify this. Yes, before that we are talking about the sequence. What is the sequence that I am showing you here? T1, T2, flare. Yes, this is a T2 weighted MR. Very good, everybody. This is a T2 weighted MR. I am seeing that the water is again quite white. Hai na? So game over, T2 weighted MR. All right. So now let's identify further. Let's go into the midbrain and try to identify the structures. So when I tell you this only, there are two green, ऐसा green जो mark कर रहा है, दो ऐसा पांडा की आंखें हैं. What are these nuclei in the midbrain? Anybody can tell me what are these nuclei in the midbrain? They are named after a color. किसी तो color के पीछे नाम है. What are these nuclei? Red nucleus, है ना? So this is your red nucleus in the midbrain. Okay. Something else also I am seeing. Something else kala kala also आगे it is running marked by the blue arrow. What is that kala kala structure? Here you have this black colored substance. What is this? मैं बताती हूँ उसके नाम में ही है कि वो काला है. There is some racist word in the name itself. Yes, substantia nigra. Substantia nigra pathology will point me towards which diagnosis? When the substantia nigra doesn't appear so black, when the nigration, the melanin which was supposed to make it black ही नहीं बना. What is that disease? Correct. Parkinsonism. So if they mark an arrow here and ask you what is the disease where this structure marked by the arrow is absent, what will you say? You will say that yes, I know it is Parkinson's disease where substantia nigra gets affected. Is this making sense? Okay, then let's look at the yellow arrow. There is one chotu sa hole where you have some fluid. So what is this structure now? Not pineal gland, it is a CSF containing structure. So what is the tiny CSF structure which is passing through the midbrain? Yes, it is aqueduct of Silvias. Aqueduct of Silvias. Remember aqueduct of Silvias? So when we had the two lateral ventricles, they were getting communicated with the third ventricle. Via what? Via what structure in that midline I was showing you? Foramen of Monro. So अब यहाँ तक तो हो गया. A third ventricle wants to communicate with the fourth ventricle, right? So how will they communicate? They will communicate via this tiny little foramina in the midbrain, which is our aqueduct of Silvias. Okay. All right. So this is basically your T2 weighted MRI, your anatomy of midbrain. Okay. Is this fine, everybody? So this is your level of midbrain. Okay. Understood? आगे बढ़े. So this level is sorted. So basal ganglia is sorted. Midbrain is sorted. If you have ever done previous year questions, you would notice कि बहुत सारे सवाल इन्हीं दो लेवल में से आपको आए हैं, राइट? सो ऑलवेज रिमेंबर अ पांडा एंड यस यू विल रिमेंबर दिस लेवल, है ना? ठीक है, आगे बढ़े फिर. ओके. 149. Yes, so now we are crossing over slowly but surely to the finish line. So now, what is the level? What is the brainstem structure below midbrain that I'm showing you here, marked with yellow? Pons. Pons बच गया, midbrain हो गया तो pons पे पहुंचे होंगे. Correct. But how do I make sure that this is indeed pons? So इसको sure करने के लिए ना कि confirm कि वो एक नंबर मेरा ही है, it is indeed pons. I have to look आगे of pons, I have to look पीछे at pons. Okay, pons के आगे देख लो, pons के पीछे देख लो, दोनों जगह पे एक एक चीज होनी चाहिए. So आगे क्या दिख रहा है? आगे काला गोला दिख रहा है सबको, वन ब्लैक कलर का डॉट. ये देखने के लिए, ये समझाने के लिए I'll have to give you one more concept. So on MRI, what was that one thing which was appearing black on everything, जिससे हम identify कर रहे थे कि ये MRI है? कि हमेशा ही काला दिखेगा, whether it's T1, whether it's T2, it is going to be black, and that is how I know it's not CT and it's MR. What was that? What was our starting point? कि ये जब काला रहा, bone, correct, bone का cortex, everybody agrees? So if cortex is black, I know that it is MRI, so it will always be black. There is one more structure which is always black. That is your blood vessel. That is your flow void or your blood vessel. Now, why is a blood vessel always black? Because how is our MRI functioning? So for that, thoda sa concept. Okay, thoda sa concept here. So MRI ke signal, how is MRI image formed? We are not giving any X-ray. What are we doing? If this is a large magnet, have you ever undergone an MRI or seen an MRI machine? ठक 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 जोर जोर की irritating आवाज आती है ना? So that is basically your MRI का magnet which is functioning. Inside that you place the person. Inside the magnet you are placing one person. Now this person has what inside him? This person has a lot of protons. Everywhere we go, we have water, we have protons, right? In every substance of our body, it's made up of protons. So what will happen is, basically, whenever I place this person with a lot of protons, all of these protons of the body, which are all actually spinning particles, right? Spinning charges, basically, they will all get aligned. They will all be like, arre magnet aaya hai, we have to behave ourselves. So all of them will align in one particular line. When all the magnets, when all the protons of our body align in one line, that will produce a signal. That is what produces an MRI signal. Now, if I tell you, what happens inside blood vessel? If this is a blood vessel, do you all agree? We have RBCs, we have blood which is moving very, very fast in the artery. Do you all agree with that? All the blood vessel is moving so fast. So when I do this MRI sequence and I place this person in the magnet, the blood is still moving pretty quickly. So what will happen? Will this blood vessel ever be able to produce any signal? No, because of such fast moving blood, no, उसमें कोई signal बन ही नहीं पाता बेचारा. Alright, that is why your blood vessels will always appear black. While other guys which are static, no, they will produce all of their black, white, gray, everything. But bichara blood vessel, because blood is moving so quickly, will never be able to generate any signal, and that is why. That is called what? That is called a flow void. What do you mean by void? The void that is there in our life, in our hearts. How do we fill it? With food, right? So here similarly you have this void which is kala void, and that is because of blood flow. Okay, so this is your flow void here. On the other hand, what about cortex? Nobody questioned me कि cortex के साथ क्या हो रहा था, वो तो flow ही नहीं हो रहा. Cortex has so much calcium and so much mineral which is packed into it that it is very tightly packed. It doesn't generate any signal. Okay, because of very, very tightly packed calcium, it also doesn't have a lot of protons, so it will also appear black. Okay, fair enough, understood? So now, anytime I see a round black structure on MRI, will you all be able to tell me that this is a flow void? This is a blood vessel which is black, right? Okay, so now हाउ वी वर एट पॉन्स कि कैसे कंफर्म करे कि ये पॉन्स है, उसके आगे देखना है उसके पीछे देखना है, राइट? सो अब मैं जब पॉन्स के आगे देखूं एंड आई आस्क यू दैट व्हाट इज दिस CSF सिस्टर्न इंटीरियर टू पॉन्स, it won't be rocket science if I tell you its name is pre-pontine cistern. Yes, will it be easy to remember? No जोर पे दिमाग, I mean दिमाग पे जोर. So pons के आगे है pre-pontine cistern. Now my question to you, which is this blood vessel which is running in the pre-pontine cistern? What will your answer be? Anatomy question, radiology question, whatever question, we want the answer. Right, it is the basilar artery. It is the basilar artery. So my learning point, pons, first thing I'm going to identify, anterior to pons, in the pre-pontine cistern, one black color ka flow void should be running. That flow void is basilar artery. If I see that, I'm very happy. Then I come back and see that there is one diamond-shaped ventricle. There is one diamond-shaped CSF collection. What CSF is left? We had done lateral ventricle, we had done foramen of Monro, we have done third ventricle, we have done aqueduct of Silvias. What is left? We are into the fourth ventricle, we are into the end game now, right? So this is our fourth ventricle here. So now will everybody be able to identify pons? आगे confirm करना है basilar artery, पीछे confirm करना है diamond shaped fourth ventricle, and then I know that this indeed is my pons here. Yes, everybody with me so far, understanding what we are talking about? Okay, तो फिर थोड़ा और पीछे जाते हैं. Let's go behind the pons a bit more. What are these? What is this hemisphere? One more part of the brainstem behind the pons, behind the brainstem. Cerebellum. Medulla तो नीचे आएगा, है ना? Medulla तो pons के नीचे आएगा. Pons medulla can never be in one same axial level. So this is cerebellum. This in green is cerebellum. And when I ask you, what is it that connects the cerebellum in the center? What is that hemisphere? If these are the cerebellar hemispheres, what connects the cerebellum in the center? It is vermis, right? So this is the cerebellar vermis in the center. ठीक है? So far so good. Pons ka level is sorted for us. Okay, let's fill this again. Now you guys help me fill this. What is the yellow arrow showing? Yellow arrow I already know, easy. It is pons. What is the blue arrow showing? What is the blue arrow showing? Pons के पीछे, which ventricle? Fourth ventricle. Pons के आगे, which artery? Prepontine cistern. Which artery runs? Basilar artery runs. Very good. Connecting the two cerebellar hemispheres in the center with red, cerebellar vermis. The two lateral parts of the cerebellum, cerebellar hemisphere. Okay, tell me. So this one, right cerebellar hemisphere, left cerebellar hemisphere. Right? Okay, wonderful. So this is our right cerebellar hemisphere right here. Okay, cool. अच्छा ये बताओ ये आगे क्या है? What are these structures? What are these? These are our आंखें. These are the eyes, correct? So you can see that these are the eyes, and then you have the, we will talk about this. So this is the eyeball basically. Okay, ठीक है, आगे बढ़े. Going to one inferior most section. So क्या रह गया अब? What is left in the brainstem? सबसे नीचे if I go, medulla, correct? So this is our medulla oblongata. This is our medulla in the center. And then what do I see? Vermis is over. I see that again, I'm just seeing the hemisphere, right? So this is the cerebellar hemisphere. But your job will be to tell me whether it's the right cerebellar hemisphere or it's the left cerebellar hemisphere. Left cerebellar hemisphere? Yes? Okay, wonderful. One more thing. What is that inferior most part of the cerebellum, which is something that is like my throat, which also looks something like my throat? These are the cerebellar tonsils. Are these important for us? Are these cerebellar tonsils important? What if they go down? If there is raised intracranial pressure and the tonsils herniate inferiorly, will we survive? We won't survive. So remember, tonsillar herniation, very, very bad. Okay. And yes, as Rijol is very nicely telling me, there is one congenital variation. We will not go into it, but there is one congenital anomaly where tonsil ectopically only is down. Alright, बचपन से ही वो नीचे है. उसको बोलते हैं क्यारी malformation. Okay, so remember tonsil down, क्यारी malformation. ठीक है, but very important tonsil, respiratory centers there, it can't come down. This is very, very vital to us. Okay, so far so good. Everybody, you have lasted for 1 hour. So congratulations on that. So this is it for today. All right. So if this amount of time is fine for you, we can go ahead with 1 hour or we can do 2 hours also. So how do you want to move ahead? From the next class, आज तो कुछ ज़्यादा ही मेरा हो गया है, इसलिए we won't have 2 hours. But from now on, can you bear with me for 2 hours? Will that work? Yeah, or you want to keep it short, 1 hour? 2 hours is fine. और 1 hour डेली तो नहीं हो पाएगा. वीकेंड वी विल हैव द क्लासेस. सो वीकेंड मतलब आपको टोटल 4 घंटे देने हैं या फिर 2 घंटे देने हैं. 2 hours each. 2 hours each works. All right, cool. So then I'll meet you all this Saturday. Then Saturday, Sunday, we'll continue from this point. Everything is fine. You guys are understanding things. That is the most important. So this will be the pace. Okay, we will guarantee questions every time कि एक एक point तो हमारा बन रहा है. आज का एक point बन गया है. We will get definite one question from basal ganglia from midbrain. All right, so that is in everybody's pocket. So what is your duty, guys, is before you come for the next class, like before you meet me on Saturday again, you have to revise this. Okay, yes, radio पूरी करा दूंगी अगर आप लोग चाहोगे तो we will continue like this, otherwise we'll stop midway and we'll decide something else. Okay, so this is how we'll be proceeding from now on. You have to revise and come what we have done in last class. So this chotu sa PDF that you have gotten today, you have to revise, and then in the beginning I'll ask you a few questions and then I want 100% on the board to answer. Okay, अगर तब सही जवाब नहीं मिला, then I will not teach anymore. Okay, so that is what is your promise to me. All right, next we are meeting on Saturday. So Saturday 10 p.m. I will see you all Saturday night. If there's any change, sometimes like time might go here and there, but Saturday, Sunday we will be having classes. या तो शाम को रहेगी या रात को रहेगी. ठीक है? All right, guys. Okay, then good night and have a good remaining Sunday and good night. Bye. Next class is also free. All of these are free special classes. All right, so just keep attending. You don't have to pay anything. I mean, you are getting the complete syllabus coverage. So like what more can you ask for, right? Okay, chalo, bye.